Hi, I'm Nurse Barb, and this is your daily dose on constipation. This is a very personal and private topic, and one that most of us don't want to talk about with our healthcare provider. And unfortunately, a lot of our healthcare providers aren't asking us about the frequency of our bowel movements. Now, before we go any further, let me just reassure you that constipation and chronic constipation is not associated with an increased risk of colon cancer. So you may have heard that because it goes through much more slowly, that might impact the colon, but that's not true. People who have Crohn's disease, colitis, and infectious types of diarrhea, they have a slightly increased risk of colon cancer, as do people with a genetic or family history. So what about regular old constipation? Well, everyone's different. And some of us go every day, some of us go once a week, and many of us go somewhere in between. There's no one right way to go to the bathroom that works for every person, and there's no normal. So while you may have friends who sometimes go 3 times a day and you're going twice or 3 times a week, that's okay. The key is it painful? Is it hard? Do you have to strain to have a bowel movement? So those are the key questions. If when you look in the toilet, if the bowel movement looks like hard little rabbit pellets and they're really difficult to come out, that's too hard. But if they're soft and there's no straining, you don't have to push really hard to get it out, that's okay. So what do you do if you're constipated and it's hard and it's painful and you're really straining? And that's not good because that can lead to hemorrhoids or bleeding or other issues. The most important thing to do is to get more fluids. If you're dehydrated, your stool is going to be harder because what happens in our colon is that as food is digested from what we eat, as it moves through our lower intestine and our large intestine, what happens is that water is absorbed. So if we don't have enough water in our diet, more and more water is absorbed from that food and the stool becomes really, really hard, and that makes it really hard to get it out. So what can you do? You drink a lot more fluids. That's 6 to 8 glasses a day. That's 6 to 8 ounces in a glass. So that's about 64 to sometimes 82 ounces of fluids a day. Also, get more fresh fruits and vegetables. And it's more important to get the vegetables because that roughage will help the stool pass out more smoothly. Here's a trick that I tell my patients all the time. That is dried prunes. Dried prunes will help the bowel movements come more frequently. And any fruit with a pit will help you poop. That means cherries, nectarines, plums, peaches. Anything with a pit will help you poop. So remember that. So lots of fresh fruits and vegetables, but also we want to stay away from a very simple carbohydrate diet. So instead of having French fries, go for a salad. Instead of having a lot of white bread, look for whole grains. That will really help as well. But what about if that's all not working? What should you do then? There are many over-the-counter products that help with that are bulk forming, and they have psyllium in it, and psyllium will help the stool move through the colon and help reduce constipation. You can find these without a prescription. You may also talk to your healthcare provider about whether something like Miralax would work, or even an over-the-counter Colase. Colase helps retain more fluid in the stool, and this is something that we use in pregnancy. It's a very, very safe option. When people have heart disease, we don't want them straining and pushing down because that can impact their heart. And so oftentimes we're advising people who have heart disease to not only have more fresh fruits and vegetables, more water, try the pitted fruits or prunes, but also use Colase. So what are some of the other things that you might consider doing? Well, over-the-counter senna can also help people have more natural bowel movements, as can magnesium. So sometimes magnesium supplement will help, or even a liquid magnesium can help. But in any case, you do want to talk to your pharmacist or your healthcare provider about what's best for you. Now, if you've been straining a lot and you notice that when you wipe, there's some little bumps, or sometimes it can feel like a little ball there, or even if you've seen some blood, that may mean that there's a hemorrhoid. Hemorrhoids are varicose veins that get pushed out and pushed open when people strain. Hemorrhoids don't feel good. They typically itch. They may burn a little bit. People can have hemorrhoids inside the rectum or outside. So if you're noticing any blood in your stool, a lot of pain, or blood when you're wiping, do contact your healthcare provider. So I hope this gives you a lot of good information about constipation. It's a very personal and private topic, but it's important that you know more. And like my favorite thing to do is to keep dried prunes around, because that really helps keep everything moving through really quickly. And the other thing is, you might try some bran muffins or a bran cereal. That's also an easy, natural way to help you have more soft bowel movements that come more regularly. All right, I hope this helps. And if you've liked this video, you can click or hit on like and subscribe, and I'll be bringing you a lot more. All right, take care and be well.